Thank you very much, and thank you very much to ICRP for the invitation to this symposium. First, I'd like to thank my co-author, Stephen Long, and the ARPANSA team for the work they've done in this space. And today I'll be talking about the Australian action to reduce health risks from radon. But first, I would like to respectfully acknowledge the traditional owners and custodians of the lands we meet on today, and pay my respects to elders past, present and future. So I'm going to first begin with a piece of rock artwork from our traditional owners. This particular piece of artwork depicts sick people from exposure to environmental contaminants. This rock art is located in the Northern Territory. And the circles represent points of disease that the traditional owners are trying to convey. And the traditional owners have been known to avoid certain areas since their creation time. And they refer to this as sickness country. And especially in the Northern Territory, these are now being correlated with areas known for high uranium deposits. And the traditional owners tell the story passed down from generation to generation to avoid drinking water in these areas, to reduce consumption of food caught in these areas, to not disturb the land. And they even restrict pregnant women going into these environments. So through their art, through their messaging, and through their storytelling, they're effectively enabling the communication of risk and to reduce the risk to them as a community in entering these environments. I think that's a powerful message, and quite a simple one, that we can keep in mind as radiation protection experts when we begin to develop our protection strategies in this space. So today I'll be talking about, in essence, the Australian National Radon Action Plan and the work we're doing in this space. First, I'm going to touch upon the Australian Radon Guidance. Just first, some basic housekeeping. Radon is naturally occurring radioactive gas. It comes from the radioactive decay of radium and is present in rocks and soil. It's chemically inert and can easily escape from the ground where we can inhale it. When we breathe in radon and its decay particles, it can cause damage to lung tissue and can lead to lung cancer. In Australia, we have published in 2017 the Guide for Radiation Protection in Existing Exposure Situations, RPSG2. The guide provides a framework for managing existing exposure situations in Australia and is derived from the requirements of GSR Part 3. So I would strongly encourage you to review this document in your own time, because it does provide some great tools in being able to effectively manage existing exposure situations. This document also calls nationally for an action plan for controlling public exposure due to radon indoors. It further also provides reference levels for exposure to indoor radon. In Australia, we've set a default reference level of 10 millisieverts per year, but of course this can be reviewed on a case-by-case basis. For applying optimisation of protection for dwellings, mixed-use buildings and most workplaces, we have a derived reference level of 200 becquerels per metre cube. And as you just heard, that sits in between the WHO and ICRP recommendations. For applying occupational protection requirements, we've set a derived reference level of 1,000 becquerels per metre cubed. So when and if that 1,000 becquerel per metre cubed is exceeded in a workplace, for instance, over time, we then recommend the relevant clauses in the occupational exposure in our code for radiation protection in planned exposure situations. And I should also point out that in Australia, workers who are not currently designated as occupationally exposed are also considered members of the public. So now moving into what is happening in Australia now. So lung cancer statistics in Australia, it's estimated that in 2009 there will be around 12,000 new cases of lung cancer diagnosed. And this represents about 9% of all cancers diagnosed in Australia. And it's estimated that this will result in around 9,000 deaths from lung cancer in 2009. And remarkably, this makes up 18% of all cancer deaths in Australia. Based on lung cancer data from 2010, it was estimated that about 80% of the lung cancer cases can be attributed to tobacco smoke. The Australian Institute of Health and Welfare has acknowledged radon as a potential causer, but has simply describes it as a low risk. With the new ICRP dose coefficients, we've estimated that this relates to, based on typical concentrations of radon in Australia, to a few percent of lung cancer cases due to indoor radon. We've been unwilling to set a hard number to this simply because of the high uncertainty of these numbers. In Australia, we've undertook in 1990 a national-wide survey of radon in homes. We sent out the survey to around 10,000 dwellings and received around 3,000 responses. The average radon concentration in Australia, in Australian homes, is around 11 becquerels per metre cubed, and about 99% of all homes surveyed had levels less than 45 becquerels per metre cubed. So we estimate in Australia that around 2 in 10,000 homes could have levels above 1,000 becquerels per metre cubed. When we can compare this to overseas surveys based on the WHO handbook on indoor radon, we can again see, based on the geometric mean, that Australia has very low radon concentrations based on the 1990 survey. One must remember that the 1990 survey is in essence measuring radon in homes based on 1970s and 1980s home builds. And in Australia, most of our homes are highly ventilated. Across the ditch, as we call it, in New Zealand, they've also recently, they did a survey in around 1990 as well, and they found levels of average radon to be around 18 becquerels per metre cubed, so again, quite low. They've repeated this survey in 2015 and have found an average concentration of around 23 becquerels per metre cubed. What is interesting from the 2015 New Zealand study was that the concentration of radon increased as you moved further south in the main population centres of New Zealand. Auckland's quite a warm climate and has probably their houses aren't as energy efficient as Dunedin, for example, where it does snow during winter. So it's probably a reflection of the energy efficiencies of homes in New Zealand compared to the 1988 survey. So in 2018, ARPANSA created a public information hub for radon, where we were able to collate all the information on our website into one spot. And now this hub is probably one of the most frequently visited websites on our website. It is highly visited. In this hub, we have fact sheets on radon exposure and health, an interactive map of Australia with typical levels of radon. We have an advisory note on the new ICRP dose coefficients and how they apply in the Australian context. We have frequently asked questions for the public. We also have our Radiation Health Committee's statement on the new radon dose coefficients, throwing their weight behind supporting the new ICRP dose coefficients, and also how to measure radon in your home. And I'm just going to touch upon a few of those points now. We have an interactive map which is based on the 1990 survey, where you can enter in your address and postcode and get the average level of radon in your suburb or area code. On the right-hand side, we have, for the Adelaide region, the typical radon concentrations in homes ranging from 15 to 25 becquerels per metre cubed. Our fact sheets are tailored for the public. It provides digestible information on what radon is, its effects, and what action should be taken. And we have an advisory note which provides an explanation of the new approach by the ICRP on lung cancer risk from radon progeny and how it's changed and how it's applied in the Australian context. Our target audience is for regulators, radiation safety officers, and radiation protection experts in the field. And the focus on the advisory is to provide advice on how to use those dose coefficients for underground uranium mines, tourist caves, and homes. We also provide radon monitoring services to the public, and we provide two different types of monitors, a digital meter hire for a 7-day measurement, and we also have a passive monitor for homes or workplaces for measurements from 3 to 12 months monitoring. And I thought I'd just also provide an overview of radon in the uranium mining industry as well. Radiation protection in this industry has been well managed in Australia over the past few decades, as we've already seen today. We have the Code of Practice, which provides a regulatory framework to manage the protection of workers and the public. And we have a safety guide that provides the specific requirements for radon for control measures, monitoring, estimating dose, education, training, reporting, and record keeping. So we do have excellent guidance in Australia, which has been well adopted and received by the industry sector and the regulators alike. So now moving on to the future and the development of a national action plan, which is now a requirement within our guide on existing exposure situations. With that, we actually do have some challenges in Australia. In the Australian context, there are only a limited set of scenarios that might give rise to sufficiently high enough radon concentrations that warrant mitigation. However, we are well aware of new housing that has become more energy efficient. So we need to ask ourselves the question how relevant the 1990 survey is. Yet, do we understand the potential for radon releases into the Australian environment? And how do we target specific work practices or regions in the country based on this information? And also, importantly, and probably most importantly, how do we engage all of our key stakeholders? And Stephen Long will provide some more insight into the challenges at our panel discussion later today. So the Australian Radon Action Plan, which we're currently drafting at the moment, there are 4 key elements that we're looking at developing a strategic direction on. The first is awareness, and that is raising awareness with all the necessary key stakeholders. Assessing workplaces and public buildings that may have elevated radon concentrations. Providing advice and guidance to those workplaces and public areas that have radon concentrations exceeding the reference levels. and in turn minimising radon concentration in new buildings in areas with high radon potential. So I'm just going to briefly look at each one of those four elements. So ARPANSA is currently working with another Commonwealth agency, Safe Work Australia, to collaborate and raise awareness of radon potential in the workplace as an occupational exposure. And ARPANSA plans to link through Safe Work to raise awareness in specific industries, probably outside the mining and milling industry, for the management of radon exposure. We're aware that state and federal regulators need to raise awareness with target industries, and we're seeing that especially with the management of tourist caves right now in Australia. We need to determine the costs associated with workplace-induced lung cancer and determine potential lung cancer risks in target industries. And ARPANSA and Cancer Australia intend to collaborate to provide advice on radon risk for lung cancer. Assessment, we need to collaborate with state education authorities to conduct radon surveys in public schools. We believe that this would be a great initiative. We need to promote assessment of radon levels in enclosed workplaces through work health and safety authorities, both Commonwealth and at state and territory level. We also need to continue to provide advice. ARPANSA provides general information on radon levels in homes. ARPANSA, in conjunction with Safe Work Australia and industry, need to develop very specific guidance, and we've actually started those discussions right now with Safe Work Australia to indeed develop that specific guidance in the occupational setting. We need to work with our protection specialists to collaborate and ensure that we have the capacity to deal with it as a radiation protection community, to assist workplaces and homeowners as well. And ARPANSA and relevant industry sectors need to partner to engage with mine ventilation providers regarding mitigation. And finally, minimisation. ARPANSA and local government associations need to partner to promote the use of a radon potential mapping exercise. This is an initiative that ARPANSA is starting to develop right now to look at Australia as a whole on where there are potential elevated levels of radon based on uranium, thorium, radium geological mapping. And ARPANSA and local government associations partner to promote consideration of radon mitigation for new buildings in areas of high radon potential. And again, we've started working in Victoria to liaise with our local government partners on new buildings and their energy efficiency. And ARPANSA and local government associations partner to review ventilation requirements of buildings in Australia. So the action plan that we intend to develop will be a 20 to 24 action plan. We're currently seeking comment on the action plan at the moment with some of our key stakeholders. And the document will sit on the ARPANSA website with periodic updates on progress to be provided. So implementation is a key element for success. When implemented, the goals of the plan aim to reduce clearly radon risk by increasing visibility and promoting broad attention for radon issues in Australia. And it will also promote some of the research needs that we've identified as well. The success of the plan, and this is critical, will really rely on stakeholder engagement and building partners who are affected by the actions or can influence the implementation of the actions. My agency can't do this alone. And as we build this knowledge and monitor the performance of the plan, we aim to refine the objectives of the plan as we move forward. So the future, this provides an overarching vision and direction for radon protection in Australia for the very first time. It seeks to align priorities with national and international obligations and it presents a long-term strategy to optimise protection for people from exposures of radon, both in homes and workplaces. And the outcomes are designed really to establish a strong foundation for future success. And my last slide is really going back to the start, and I really hope that we can build a successful action plan over the centuries, just like the traditional owners have done in their particular country. Thank you.
Thank you, Rick, for your comprehensive overview about the management of radon in your country. I think it was very interesting. We have received a few questions. I'd like to start with the one saying, given so low average radon in air concentrations in Australia, why did ARPANSA set the Australian reference level at 200 becquerels per cubic meter and not to a level below 100 becquerel per cubic meter?
Historically, the 200 becquerels per metre cubed was set in the 2000 Code of Practice, and we felt that in revising the derived concentration limit that we didn't need to change it, although we did realise that radon levels were typically low in the Australian environment or in Australian homes. But we do realise that there are potential for higher levels of radon in homes that we're potentially not aware of at the moment.
Okay, thank you. We have several questions turning around this issue. For example, given the low risk for radon in Australia, is there really a need for a new radon action plan? What is the meaning of minimization where concentration levels are rather low? So what could you respond to that?
I think what we've realised from the 1990 survey is that building structures have really moved towards, in Australia, more energy efficient homes and offices and workplaces. And we need to ask ourselves the question on what the impact of radon levels are in these new energy efficient homes. So I think there's now a question about the 1990 survey. We have confidence in that survey results, but it really reflects homes that were built over 50 years ago. We know that they have changed. So we do need to take that precautionary approach and start to revisit radon in Australia to ensure that we are providing the optimum level of protection for members of the public and workers in Australia.
Thank you. There is here an interesting question. Energy efficiency improvements in homes significantly increases radon concentrations in home. Have the radon hazards been fed back to buildings in standards, in particular in retrofitting efficiency improvements?
We've had some initial conversations with building associations in Australia. There is a requirement for certain ventilation rates to be maintained in homes. However, we're still in the initial stages, and I guess this is what this action plan is calling for, is to further investigate and work with our building partners that set building standards to ensure that we are addressing radon.
Okay. Along the line, there is also this question, does Australia government regulate, control the content of building materials in order to ensure the exposure to radon in home not exceed the reference level?
I guess that's a complex question, looking at radioactive material in building material and the way buildings are constructed in Australia. The existing exposure guide does deal with building materials as a separate issue, but if combined with radon, it probably does need to be addressed. So we have the tools available to assess that risk. However, we don't regulate building material as such for its radionuclide content.
Thank you. Another question. Has there been any attempt to correlate the use of bore water or rainwater to radon doses in homes?
I'm only familiar with work done in New Zealand where radon in water is an issue and has been proven to be one of the key drivers for radon in homes, especially in Christchurch area. So they actually do have limits on radon in drinking water. I'm unaware. I do believe there has been some studies, but off the top of my head, in Australia, I can't quite recall what the outcomes are.
Thank you. And maybe the last question. When will the 1990 radon survey in Australian homes data be updated with new radon survey data?
That's a great question. I guess the challenge in today's environment is the cost of doing such surveys. So in the first instance, we're going to be doing a radon potential map to understand where there is potential for elevated radon levels. And that may allow us to maybe more focus a targeted survey in those areas to reduce the volume of homes that we need to survey.
That's clear. Jean-François, from the floor. Very good.
Thank you. I had two questions, but you already addressed one of them. The first one is about the spatial distribution of radon. Normally, and this is the sense of this message, we should have a radon-prone area in an area where there are uranium mines. And seeing your map, it is not clear. Could you give more information about that? And the second one is related to building materials. You just said that finally it seems not to be a problem in Australia. Then it means that the main source of radon is the soil. And then I come back to the issue of mapping. Could you give more information? Because it could be important in terms of, you have only a few cases of high level of exposure, but if it is concentrated in a few places, you could have a problem.
Yes, so we have correlated the home survey with geological maps where we have a good understanding of uranium, thorium, radium content. And indeed, it does correlate with some of those, does correlate with elevated levels of uranium through those surveys. I guess with the Australian population, a majority of our populations live in cities, not where the elevated uranium deposits or elevated uranium is in soil in Australia. So we do need to do this potential mapping to look at our country communities to better understand where those elevated levels are.
Thank you. Yes, of course.
Yeah, if I may have a question now related to the picture that you show. You mentioned at the beginning that the traditional owners avoided areas with high radon concentration. Is this well documented? Because if it is, it would be a strong argument against radiation hormesis.
So in this particular case, it is associated in Northern Territory, this particular piece of rock art. And it also includes heavy metal contaminated sites as well. It's been correlated with. So in fact, they've taken an holistic approach to their protection of their people. It is through the traditional owners' storytelling. So it's very much a verbal communication that they use to tell their story from generation to generation with pictures like this to assist in generations as they move forward. But I can tell you that the respect the traditional owners have for the country and their link to country is quite amazing, and they do really rely on their storytelling to dictate where they can and can't go. As we saw yesterday through the opening with Jack.
Thank you. So I think it's nice to finish on some consideration on this picture. I think many of us will remind this picture. It's very moving. Well, thank you, Rick, for your presentation. Thank you for the clear answers to the questions. I'd like now to invite you to, we are going to close the session and invite you for joining the lunch. But before, I'd like to thank once again all the speakers.